Hey, how you doing, guys? So this is Dr. Suh at Specific Chiropractic. So in this video, we're going to talk about tinnitus or ringing in the ears and also TMJ. So let's fool the viewers, okay? How long have you been having this ringing in the ears, tinnitus?
About 3 months.
Past 3 months, okay. And what is it? What are the symptoms of it you've been experiencing so far?
Clogged ears and the vibration sound.
Okay, all right. What's also going on with your TMJ?
So I have trouble opening my mouth fully when I eat and I chew. It hurts, especially on this side.
Mm-hmm.
And I believe it's because at night I clench.
Mm-hmm.
And when I wake up in the morning, it's like really tight.
Gotcha. Another component is also to the viewers, okay? Clenching your teeth at night and grinding them too, I presume, right?
Yeah.
Yeah, that's what we call bruxism, all right? So we'll take a look, we'll see what's going on with that. Going down your history, you're talking about ringing the left ear, clogged ears as well, okay? And in terms of eustachian tube. So now neurologically, what's going on is this region of the spine over here, it supplies nerve function to the soft palate, part of the trigeminal nerve, okay? It goes, which is the very roof of our mouth. Now, if that roof itself collapses, the eustachian tube gets hit onto it, it does not allow the fluid to drain from our ear down the eustachian tube and into our mouth. If you can't do that, ear gets built up a little bit.
Yeah.
Okay. So now you have not experienced any dizziness or nothing like that so far?
No.
Okay, so that's good. Okay. Now the reason why I asked you about that and to the viewers, okay, that's also, if we kept on building this up, eventually it progresses into Meniere's disease, and that's something we want to try to avoid. Okay. Mm-hmm. So it's this area over here, okay, and that's what I see as well. This cervical, that disc is very swollen. I want to take a look on that on examination, see what's going on with that fellow. And we also see it here as well. It's just like wedged gap right over that way. It's causing this one to lean that way.
Oh, okay.
And since it's leaning towards that way, that's what's causing your jaw. Rotate that way a bit, right? So therefore, then with the back traces is what caused all this mess over here. Then we see a nice little twist going on over here, another counter twist over here, another counter twist over here, another counter twist over here. So that's also what I'm tracing over here. Okay, normal, I want to see an angle this direction, but it went complete opposite direction. And I'm seeing this very steep kyphotic angle over here. Okay, normal, I want to see a nice curvature, like a rainbow arc, but I just want a severe kink like this.
Okay.
So what causes that? Then I want to trace it down, and all I'm seeing is inferiorities. That means your bones over here, normal, okay, it should be like over here. And when people do acquire some trauma from time to time, the bones do move backwards like this. You have this additional fun of tilting backwards like this, what we call inferiority.
Oh, wow.
So I'm tracing it. You don't have just one, it's everything like a stair-step effect. One after another after another. Keep on going. I want to trace it all straight down. Where is it? Bottom line is, I want to find where it doesn't have that inferiority anymore. And that tells me, so, okay, that is the potential culprit we need to address. But no, I keep on finding it. It keeps on going all straight down to the fifth lumbar. And then we take a look at the pelvic foundation itself. Okay, I see a open gap wedge like this on the second sacral segment, so that might be a potential contender. But if we take a look at the AP view over here, I'm seeing a whole entire sacrum sinking down on the right hand side. And this line, which should be in the middle, it's all to the right. That tells me what your body's doing right now is your hip went this direction over here, sunken this way, that way over here, okay? So obviously, we're not gonna walk this way, okay? So the head, it wants to be centered and level like this, but the body's gonna kind of twist to compensate for that. That's why we're seeing all these twists going on over here. But to make this kind of kink over here tells me, no, you have some kind of severe inferiority. And I believe that you had this double whammy. This might be the old injury over here, or more recent one or the other, but this one made things unstable to the point that the foundation where you're supposed to move a little bit like this, but it's moving a little too much. So when it moves too much, it starts to aggravate this fifth lumbar disc and knock this bone going backwards like this, And when it goes back like this, it's not just this one bone. Everything else above it also start going leaning backwards, just like a tower of Jenga, okay?
Yes.
And just by pure miracle, it doesn't really topple over yet, because over here, it's leaning over so much like this, you cannot walk this way. So your body deliberately walk like this way. Yeah, so that's what we're seeing, this major kink here.
Wow.
Yeah, that explains everything. But the problem is, since you have the additional fun of being rotated and twisted so much, here's the thing, the brainstem over here and the spinal cord, it doesn't like to be so severely twisted up like this. It hates it. So what your body's trying to do is over here, is trying to counter twist opposite direction as best as it could. And in order to do that, that's how it made this. It deliberately reverses the neck over here to try to untwist the spinal cord of the rest of the body. That's why we have to address the root cause of it. And that's what we're going to determine. Is it really coming from the right hip or the second sacral segment? And even after those two, I still have to address this fifth lumbar inferiority. Get this angulation here, because right now this is straight as a rod over here, as a flagpole here, and it's straight over here, and then this kinks real hard. So that's why I have no choice. Most likely I have to address this one too, to get you some more stability and levelness on the rest of the spine over here. Otherwise, I could adjust this all day long, and also see your TMJ. It's not going to stay put ever until we get to the root cause that started the whole that downward effect. So it's going to be this. I'm going to take a look at what's going on here, 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 and then finally up there and your TMJ.
Got it.
We're going to start off with visualization and inspection. I want to see where the swelling, where the body's trying to stabilize and protect itself. So we got something stabilizing the neck over here, more so on the left side. Okay, same thing here. I'm going to mark this level here. It's all swollen here. Here as well. Quite a bit. Okay. Right here as well. So we're going to start over instrumentation. We just want to confirm, take a look at some potential levels. And then there's your pelvis right there. Right here. Right there. So now let's figure out which one is the actual fella. That's swollen right there. How's this fella right here? Not too bad?
No pain.
What over here?
Yeah, that hurts a little.
Okay, so it's a 2S. Right hip is not too crazy. It's kind of stuck too, but it's 2S. Okay, so this is the priority. We'll address this one first. And a follow-up visit, we'll keep an eye on that right hip. See this fifth lumbar, that's a brick wall. That's not moving at all. See, this is compensating. Some fixation, but I believe that's going to go away once we address that fifth lumbar. This one may require adjustment. We'll check afterwards, but this will need adjustment. This one is a compensation or a subluxation. That's not going to adapt too well. And this is not too great. You feel that big knot right there?
Yeah.
Yeah. See, that's your fifth circle. Your body's stabilized and try to protect this fella right there. Yeah, Alice is quite rotated. Interior. That explains the TMJ. Okay. Okay. Let it drop. A little more, and
It feels, I don't know, straighter.
feel straighter. How's the jaw? Any difference in there?
A little bit.
How much difference?
Like 40%.
40%, right? Yeah, because we're starting to untwist and they're already stabilizing just from the foundation alone, which causes a whole other domino effect. Yeah, right here. Right there. Okay. Relax. Very inferior. Let it go. Good. Right there. Walk around, so you like it?
I'm better able to open.
Okay.
Less, tight.
Good. What other changes you noticing in that left ear?
I still feel the sound.
Okay.
Yeah.
It may take some time for your ears to drain out, okay? So that usually takes about 36 to 48 hours. You may experience three scenarios. Either A, feels like a waterfall down your throat, or B, feels like a postnasal drip. It's like there's some stuff dripping down, okay? And then C is more like, weird. It's like a little ticklish in the back of my throat. I feel like I need to cough something out, but nothing's coming out, okay? If you want to speed up that process, get a nice steam bowl of water, okay? Drape over a towel, breathe the vapors in to try to clear up more of that stuff out, okay? Open, close, open, close, open, close, open, close. Okay, come on up. You know that was intense.
The ears is the same, but this is a lot of relief here.
The TMJ?
Yes.
All right.
Yeah, it feels like it's open
Hey, that's great.
and not tight.
Okay, so like I said, we'll do a follow-up. Let's see how the left ear is coming along. All right?
Okay.
Okay, we're all set.
Sounds good. Thank you.